Good afternoon, everybody. Thank you for joining us for the ScreenU Marijuana webinar hosted by the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. We are so excited to show you this. We've been working on this for close to 2 years, and we've been piloting ScreenU Marijuana recently with 28 pilot schools around the country. We've gotten some great feedback, and we're looking forward to hearing your feedback. At any time during the webinar, if you have any questions, please utilize the chat function. It should be on the right pane of your webinar software. Just shoot us a question and we'll get to them at the end. We will be sure to make time for questions. And you can also raise your hand if you're interested in asking a live question. I am here with Cindy Clowner, our prevention specialist at the Higher Education Center. And as you know, my name is Kristen, and I am the program manager here at the Higher Ed Center. A quick little overview of who we are, if you are new to the Higher Education Center. We are an academic center here at The Ohio State University. It's a partnership between the College of Social Work, the College of Pharmacy, and the Office of Student Life. We fund and run the collegiate recovery community here at Ohio State. We are funded by the Conrad and Hilton Foundation, and we're a partner with the Generation RX initiative, Safe Medication Practices for Life out of the College of Pharmacy. I thought we could do a brief overview of SBIRT. What it is, if you're not familiar, SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. And Cindy Clowner, our SBIRT specialist, is going to tell you all about it.
Thank you, Kristen. So just like Kristen said, SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. It's an evidence-based intervention that's been endorsed by the World Health Organization and SAMHSA as a means for early intervention if someone is at a higher risk for developing a substance use disorder. So before we talk a little bit more about that, I'm interested to know how many of you may use SBIRT on your campus. So Kristen's going to pull up a poll. It should show up on the right-hand side of your screen in just a minute. And we'd love to know if you are using SBIRT in person on your campus. So if you could take a moment and respond to that. And as you're doing that, we'll just kind of continue chatting about SBIRT. So it historically has been implemented in healthcare settings in a one-on-one environment, and it uses motivational interviewing principles at its core. And so when a person is participating in SBIRT, they begin with a screening, which is a quick assessment of the severity of substance use and identifies the appropriate needs beyond that. So if a person has low risk, then maybe they just need a little bit of education. If a person has a higher risk, then maybe they need something more intensive, like a brief intervention that can be done in person there. And those brief interventions focus on increasing insight and awareness regarding substance use and motivation towards behavior change. And for those that have the most severe risk, they may receive a referral to treatment and connecting them with additional resources that can help support their needs. So let's take a look at our responses and how many of you are using SBIRT. So there we go. So there's our responses. So it looks like of those, we have most people aren't using SBIRT on their campus or aren't really sure if they're using SBIRT on their campus currently. And I think one of the reasons why that happens is because there's a lot of barriers to implementing SBIRT in person on a campus. One, it's pretty resource intensive because it's done typically in a one-on-one setting. So someone has to be trained in motivational interviewing. Because it's one-on-one, then that's a lot of staff time that is being used for SBIRT. And so when it came to developing ScreenU, our goal at the Higher Education Center was looking at how we can move SBIRT beyond a traditional healthcare setting and help reach more students, understanding the constraints that colleges have in terms of the resources, both time, money, and staff. So ScreenU was developed keeping the principles of motivational interviewing in mind. So we follow a lot, basically the same trajectory that we do with SBIRT. So first, students will take a screening. And as Kristen had already mentioned, ScreenU currently has 3 programs: ScreenU Alcohol, ScreenU RX, and ScreenU Marijuana. And of course, today our focus is on the ScreenU Marijuana program, and we use the Q to R as our screening tool for the marijuana program. Once a student completes the screening, they receive feedback based on their risk level, and then they will respond to some open-ended questions that simulate the motivational interviewing process. Once they complete that, they receive some resources and strategies for change to reduce their risk of developing a substance use disorder.
We're going to review something that's called the prevention paradox, something that I'm sure most of you have heard about and you use it, or the idea of it, in the work that you do on college campuses. The prevention paradox describes the seemingly contradictory situation where the majority of alcohol-related problems, or in this case, marijuana-related problems, come from a population at low or moderate risk for marijuana dependency or misuse, and only a minority of the cases come from the high-risk population. This is one of the reasons why we decided to take SBIRT out of the one-on-one individual intervention and move it to the population level. A lot of students do receive really wonderful resources and interventions as soon as they perhaps go through the student conduct process or are already at high risk. What ScreenU does is it can offer a campus an easier population level way to reach students regardless of their risk level. And again, the majority of problems that are related to marijuana use on a college campus come from those students who are in the low or moderate risk level range, not the high risk students. There are a few reasons why the Higher Education Center invested in creating ScreenU Marijuana. For one, the number of students who say they use marijuana is continuing to grow. From 2006 to 2015, it jumped 8% in the college population. 1 of every 22 college students surveyed said they've used marijuana at least 20 times in 1 month. So that means they are heavy, high-risk users of marijuana. Surprisingly, it is the second most common reason people are receiving treatment for a substance use disorder, right behind opioid use. And then in terms of the students, there are a lot of academic consequences, health, safety, mental health consequences. Impaired driving is a large concern for a lot of our campuses, concentration problems. Students who use marijuana have been shown to regularly put themselves in danger at a higher risk than those who don't use marijuana. Poor class attention, and then again, mental health concerns. These students have a higher risk for anxiety, depression, and schizophrenia. So it is a concern for a lot of our campuses, not only in the college population health level, but more broadly. So screening, brief intervention, referral to treatment for marijuana is a relatively new phenomenon. It's something new that has recently been studied. So there is a growing body of research around SBI for marijuana, especially the web-based SBI for marijuana. When you're thinking about what you want ScreenU Marijuana to do for your campus, make some clear goals around and what you would like this program to do. Some campuses really want their students to have a different risk perception of the use of marijuana. They feel that their students don't have a reasonable or normalized perception of the risk that marijuana can provide a student. They want to provide education for their students. They want to increase the number of students that use the resources that they're provided on campus. A lot of students don't know how well they're supported on campus, and they want an easy way for those students to be referred if needed. They want to reduce the negative consequences that can come from marijuana use, such as academic consequences or impaired driving. And some campuses really want to see a snapshot of what is going on their campus. What risk level are their students currently at? What is the use level? How many students identify as being in recovery? Perhaps they need to support those students in a new way that they haven't thought of before. And some students or some campuses really just want to reduce marijuana use on campus per individual. So there are a few studies. One in particular, White from 2006, studied the difference between in-person SBIRT for marijuana and web-based SBIRT for marijuana, and noticed that there was no difference in the effect size based on whether or not it was done in person or over the web, which is promising for future research around this issue. A quick little visual depiction of the findings. EverFi did a really neat, robust study about all the interventions and all of the education and prevention going on college campuses. And they basically set out to figure out the impact versus the cost. So we see on the x-axis the impact. Further right, the more impactful the intervention or the prevention program is. And the higher on the y-axis is the more costly interventions or programs that you could implement. What I want to call out to is number 29, which is SBI in the healthcare setting. So this does refer to one-on-one SBI in the healthcare setting. So a student health center, for instance, a physician or a nurse providing the one-on-one motivational interviewing. So we see that it is extremely impactful compared to what else is out there and available for campus professionals. We also see that it's rather costly. So it's a little bit over $15,000 per year on average to implement screening, brief intervention, referral to treatment in the healthcare setting on a college campus. We see that as a huge barrier, as many campuses do. And as we learned at the beginning of this webinar, probably one of the reasons why SBIRT isn't being as widely used on college campuses as SAMHSA would hope. One of the really exciting things that we're hopeful for is the ScreenU marijuana program being readily available in the fact that it is very affordable to use. And then it uses the same science behind SBI in the healthcare side.
So we're going to just dive in and really take a look at ScreenU now. And as we've been mentioning, ScreenU started with the alcohol and prescription drug version, and marijuana has followed really because of the demand from all of you for an intervention that is related to addressing marijuana use on your campus. And we developed ScreenU with the principles of SBIRT in mind, and we digitized the process from start to finish so that we could move ScreenU beyond the traditional healthcare setting. So here are some benefits about ScreenU in general, and of course, these apply to ScreenU marijuana as well. The program is web-based. It doesn't require an app to be downloaded, but any student can access ScreenU on any web-enabled device. So they can take the screening on their phone, they can take it on their tablet or laptop, and it really helps meet students where they are. One of the most positive comments that we receive about ScreenU is the brevity of it. It's very short. It takes 10 minutes maximum for students. And because of the brief nature of the screening, it really lends itself well to being repeated throughout the year and throughout the time that a student is on your campus. ScreenU is really simple to implement. It doesn't require any training, and it can be used in a number of departments on your campus because of this. It connects students with vital resources. We've talked about the importance of that, and we know that students are on our campuses for 4 years and oftentimes don't realize how well supported they are on your campus. So this is an opportunity to get all of those resources, both local on your campus and within your community, in front of your students to see what is available to them. And we'll talk about the different methods that students can continue to access those resources once we move into the screening. For campus administrators, it provides real-time reporting, and we're going to dive into the dashboard in a second, and you'll get a chance to take a look at the reporting features with ScreenU. And it also provides some customizable elements. Campuses have the ability to upload their logo so that when a student takes a screening, it looks like it is officially sanctioned by your university. You have the ability to customize your welcome and thank you messages by campaigns, and there's a few other ways that you can customize the program so that it meets the needs of your campus community. As Kristen mentioned earlier, we've been piloting in 28 campuses, and the states that are in the light green represent states who are currently piloting ScreenU Alcohol and ScreenU RX, and have been working with us to do some testing of ScreenU marijuana. So where are campuses using ScreenU? Of course, SBIRT really was born out of a healthcare setting, and we still have campuses that utilize ScreenU in their student health services or their counseling centers, either in their waiting rooms as students are waiting, or we have some campuses who do it in tandem with a provider once they are being seen. Other areas on campuses that ScreenU is being implemented include student wellness with our academic advisors, Greek life and athletics, so with groups that are typically considered higher risk groups on your campus, first-year students through orientation programs, outreach events, residence life, and we have a number of campuses who are using it as part of the conduct sanctioning process. So we are going to take a look at the dashboard here. So give me 1 second and we will pull up what that looks like. Okay, so what you're looking at now is the ScreenU dashboard, and we may have some people who have participated in a demonstration of ScreenU in the past, and you may be looking at it and think this looks just a little bit different because we just have launched with the ScreenU marijuana, we've launched some additional and we're really excited about the user ability that it'll add to your experience with ScreenU. So this is the campus dashboard that you're seeing. Right here, this is a test dashboard, just this is all test data that we have done as we've been testing ScreenU. It's not representative of student data. And this is our HEC AOD account because of that. So right here is where your campus logo would be, rather than our Higher Ed Center logo. So the dashboard just provides a top-down view of ScreenU so that you can take a look at what your screenings are doing. So right now we can see all of our campaigns for ScreenU alcohol and what the overall risk level is. So the teal bars represent our campus data, so all campaigns associated with ScreenU alcohol from our campus, where the purple bars represent our national data, and that is the national data from our pilot campuses. So what you're seeing right now is our 28 campuses who are using ScreenU, what the results are in aggregate of the students who they are screening. So it's important to note that because campuses are using ScreenU in different ways, is not necessarily representative of national results in terms of use with students. So the ScreenU process begins with creating campaigns, and a campaign is a grouping of screenings that it's a way we organize those screenings. When it comes down to the screen, we only collect a few demographic points. We collect the gender, class rank, and age of students. And so by utilizing campaigns, we are able to organize that data in ways we may want to view reporting later. So for example, if our campus was looking to screen all of our student athletes, we may create campaigns by team. So we may create a campaign here that is the women's soccer team, and we'll assign it to a program. And one of the other great things about ScreenU is, and our newest iteration, is the ability to assign departments to a campaign. So because of that, we can, in our Manage Campus tab, if you're a campus administrator, you can assign a number of departments, and any campaign that's created within that department is only seen by users that are also within that department. So for example, in this campus, we have 2 departments, a default department that all campaigns will fall into if they're not assigned to another, as well as counseling services. Of course, we can add as many departments as we'd like, but once we assign that campaign to a department, only users who are also assigned to that department will have access to the campaign and its associated data. We can also set up a start time and an end time for our campaign, and the program will automatically launch our campaign based on that start and end time. One of the customizable features of ScreenU is the ability to customize the welcome and thank you message by campaign. So for example, since we are sending this campaign out to the women's soccer team, perhaps we include a sentence in the thank you content encouraging them to reach out to their coach if they have any questions. So once we create a campaign, we have the ability to kind of see some of the basic stats of it. This link right here is a direct access to the actual screening. So we can deploy this screening in a number of ways to students. We may round up the women's soccer team and provide them all with this link, and they can take the screening. We can send them an email with this link, and all students would take the screening from this same link. But we have another option available to campuses who may be interested in tracking the completion of screens. I think it's important to note that ScreenU is anonymous. We don't ask for students to use their email addresses, student IDs, or names when it comes time to take the screening. However, we have the ability to use email addresses to track completion of a screen for students. So a campus has the ability to upload a CSV of all of the email addresses of the students that they would like to screen. And in doing that, they can also create an email that the system will automatically send out to all of those students. So right here is a template, and campuses can edit this template however they see fit. And once they're done editing, they can upload a CSV here. And once they hit submit, the system will automatically send out emails to each of those students with a unique collector link that they can use to complete ScreenU. And once they do that, they can download this identified student CSV to be able to track completion. So because we just created this campaign, of course, our CSV is going to be empty, but you can see we would see a student's email, their screening link, and when they've completed it. And we can take a look at one of those completed CSVs in a moment. So let's get back to our, give me 1 second, we'll get back to, there we go. So once you have campaigns, you'll be able to go to the My Campaigns page and see a list of all of our campaigns that we've created. And here's our women's soccer team campaign listed below. So campuses also will need to upload campus resources to their dashboard so that the screening can automatically populate those for their students. So here is where you would do that. So we have, of course, our 3 different programs, but one of the other areas where campuses can upload resources is the recovery section. So students have the ability to indicate whether or not they're in recovery when they take the screening. And if they indicate they're in recovery, they'll receive resources that are from this recovery section. So we can populate resources from a number of different categories, and you can see those categories here: student wellness or health promotion, student health services, collegiate recovery programs. We have over a dozen categories that are just here for campuses to consider all of the possible resources that are on their campus and in their community. So students don't see these categories. It's not necessary to populate them all. However, we do think for ScreenU to be successful, it's really important that campuses consider populating health promotion and wellness, counseling, student health services, study skills, support groups, a collegiate recovery program if it's applicable to your campus, and a recovery ally. The rest of the resources are available under the additional resources header, so that students can still have access to those. So we're going to quickly look at reports, and then we're going to move back and walk through a screening so that you can take a look at those. So here is an example of our reporting dashboard by campaign. So you see we have the ability to export as a CSV. By doing that, we will see all of the screens that have been completed from start to finish, including the open-ended questions. We have the ability to filter the start and end date, as well as see how many screenings have been taken over time and how many students who we have sent those identified screening links to have completed them. So attached to this campaign, we sent out 2 emails with a unique collector link, and unfortunately, none of those students have completed that screening yet. So that could tell us that we need to follow up with those students by taking a look here. Of course, we can download that identified student screening CSV to know which students haven't completed it, and we can send a follow-up email reminding them to do so. So here is an overall risk level view of our ScreenU alcohol screening, and the marijuana screening looks just like that. In fact, we'll go back there and take a look at that one. So we have a few less screens here, but you can see we have some students who've completed the screening. Our risk levels in recovery: no use, low, moderate, and high. As we hover over each section, we can see both the percentage, what the category is, and the raw numbers. We also are able to take a look at the overall demographics here. That's what our bar graphs are looking at: age, gender, as well as class rank. And we can dive a little bit deeper when it comes to the responses by clicking on one of these areas. So if I click on in recovery, it's going to expand the demographic section to show me the gender of those students who responded in recovery. So we only had 2 students who responded in recovery here, and we know they're both female. We can look at the age and the class rank, as well as how they rated with importance, confidence, and their readiness for change. We can also take a look at these responses, how students responded by question. So we're able to do the same thing by question by clicking on an area and expanding to be able to dive a little bit deeper and see the demographics of the students and how they responded to each question. So all of the questions that we ask for the QDIT are here in the reporting. ScreenU also provides a campus level report. This pop-up here is our first-time user experience. That's as people sign on for the first time, it'll walk you through the program to give you an idea of what you need to do. And as we look at, again, our marijuana program, we can see the campus view for the risk levels overall. So the reporting is the same structure, but it uses all of the all of the campaigns that are happening on a campus in aggregate, and we can filter by date level as well. We also offer a compare reports feature, and I'm going to stick with ScreenU alcohol for this one. So we have a few more numbers to take a look at. And we'll compare a couple of campaigns. So you can see we can take a look at the screenings over time, as well as their overall risk level. And again, we have the ability to compare specific risk levels and see the breakdown. So the structure of the reporting is the same for all of these, but you have these different features available. So now let's take a look at our screening. We're going to walk you through some screenshots from the screen and let you take a look at those. Okay, so as we've mentioned before, everyone starts with a welcome message and they answer those demographic questions. So this again is the welcome message that's pre-populated, but you'll have the ability to edit that welcome message as you see fit. For marijuana, we actually ask an additional demographic question. So we ask about what state you're from so that we can identify the appropriate legal feedback for your student. Once a student has answered those demographic questions, they're led to the gateway questions. So we're asking students if they've used marijuana in the last 6 months, and if they have a physical recommendation to use marijuana for a specific medical condition, as well as if they've used marijuana in a way that's not consistent with that doctor's recommendation. So based on those responses, students will go down a few different paths. And if a student says that they haven't used marijuana, they'll receive some positive reinforcement, but we're going to take a look at what a student would see if they indicate that they're in recovery. So here's a sample of our recovery resources page. Students who indicate that they're in recovery receive this kind of feedback with some additional resources, including our collegiate recovery community on campus and our program manager in the collegiate recovery community as well. If students indicate that they say no to all of those questions, that they haven't been using marijuana, they receive that positive reinforcement as well as some important information that they can share with friends that may be using marijuana to help them reduce their risk. But if students says yes to one of those questions, or they indicate that they may have a recommendation to use marijuana from a physician, but they are misusing and going against those recommendations, then they'll take the full screen, the Q-R. So here's 3 questions. This is what a student would see. Again, they can take this screening on their phone, so it'll be optimized for their phone, or they can take it on their tablet. And once they complete those 8 questions that screen for a cannabis use disorder, students will answer these 4 questions that we call consequence questions. And what they do is help us identify students who may be experiencing negative consequences because of their marijuana use. So we're really focusing on these 4 areas of, are they experiencing financial burden? Are they using alcohol and marijuana at the same time? Are they driving or using other kinds of motor vehicles, or being involved in other physical activities while using marijuana? And are they experiencing academic consequences? And when we designed ScreenU, we really designed it in mind of a few goals. One being identifying students who currently have cannabis use disorder, connecting them with resources, but also identifying students who are at a higher risk of, or who are experiencing these negative consequences, giving them some education and tips to reduce their risk, and increasing the risk perception around marijuana in general for students, because we know that is a challenge right now, that a lot of students don't see the risk or the harm in using marijuana. So once students answer these questions, then they receive some feedback based on their risk level. So in this sense, we had relatively low risk, and we also used Ohio as our state. So Ohio now has legalized marijuana to use as medicine in our state. So we received feedback specific to that. If your state marijuana is legal for use recreationally and medicinally, the feedback will reflect that. And as well as if your state it is illegal for any purpose, you'll receive feedback that is reflective of that legal status as well. Once they receive your risk level feedback, they'll receive feedback based on how they responded to those consequence questions. So each question has some corresponding feedback that is assigned to it. So in this situation, I responded no to all of them, but yes to using marijuana with alcohol. So this is the feedback that I would receive if I responded in that way. Once I review my feedback, then I'm transition into open-ended questions. These are our evoking change questions, and they're meant to get people to think about how making a change regarding their use would impact their life. What they would need to do how they could identify if they needed to make a change, what the positive impacts might be, and what the challenges might be to get them to start thinking about that. And this really helps, is representative of the motivational interviewing process that would take place during in-person SBIRT. Once a student completes that, then they move on to our readiness scales. And so the first scale is asking about how important it is. And students will receive open-ended questions based on their response. So in this situation, I responded with a 9. I feel like it's pretty important to me. And so this is the open-ended question that I received in response to that. So a 9 sounds like it's pretty important. Who's been supportive of you in the past, and how can they help you? So hoping to push people further and giving them some questions to get them thinking about how they can make this more important, or how they can move forward in their choices around marijuana. The next question is looking at how confident you are, and I chose different responses so you could see different questions here. So if I said, well, I'm kind of confident, I'll say I'm a 5 here, that I'm going to receive questions that help get me thinking about, well, at least you're a 5, you could be lower. Why are you a 5 rather than a 3? But what would I need to do if I wanted to get to be a 7 in terms of how confident I am? So a student would respond to those questions. And finally, the last scale is how ready I am to make a change. And maybe it's really important, and maybe I'm kind of confident, but I'm just not quite ready yet. And so the questions respond in that way. So it sounds like you're not ready to make a change yet. Why are you a 2 and not a 0? How will you know when it is time to think about changing? And of course, again, these questions are responsive based on the number that a person assigns to each of those readiness scales. Once a student completes all of those scales, then they receive their resources for ScreenU, and it includes some tips to reducing their risk for negative consequences, as well as those resources that were populated by your campus. And you can see these arrows here. When it's live, a student can expand those resources and get this additional information that can connect them to their resource on the campus or in the community. So we have the ability to add a description line, to see the address, the phone number, and email, and a website to be able to reach out to those resources that may be able to assist us. And all of those resources are customizable by your campus. Finally, the last page of ScreenU is that thank you message, which again is customizable, but we also allow students to have the opportunity to download, print, and email their resources page to themselves. And we don't capture that email address anywhere that a student puts in here. So it just, the email goes to them, and then they're able to pull up a PDF of their resources with all of the contact information for their resources so that they can access those at a later time. One of the other options that we included is the ability to download, print, and email yourself a certificate of completion. So campuses can use this as a way to track completion as well. So we've walked through the screening and we've walked through the dashboard. And if you have any questions, we encourage you to reach out using that chat function because we'll be happy to answer them for the group. But we also want to make you aware of some next steps that will be available. One, you're able to go on to www.screenu.org and you can request a 7-day demo by going to the About and Demonstrations page. So we encourage you to do that. If you have already had a demonstration on our old system and you would like to demonstrate with the new system, please reach out to us by email so we can set that up for you. We will be ready to launch ScreenU nationally early 2017, and we'll be doing so through a membership package or a single program. So now, if you're interested in using ScreenU, is a great time to gather your stakeholders on campus. We're happy to set up one-on-one demonstrations with you, and you can schedule those on your own by going to go.osu.edu/ScreenU demo. And we can do those demos with just you or with a group of your stakeholders on your campus. And we're happy to do those at any time. So we encourage you to visit there if you're interested in scheduling one of those one-on-one demos now. It also is a great time to audit the resources on your campus to make sure that they're adequate. And we can provide you with the full list of resource categories, but you know what's best on your campus and what's appropriate to include for ScreenU, as well as within your community. And if you're interested in using ScreenU, now's a great time to pull all of those together. So once ScreenU goes live, you can upload those resources and you're ready to go and launch some campaigns and start screening students.
Awesome. Thank you, Cindy. I've received a couple questions. A majority of the questions were about the slides. We'd be happy to send the slides to everybody after this webinar. We are also recording it, so there will be a link to watch this again if you'd like to share it with some of your stakeholders on campus. Secondly, a lot of people are interested in demoing ScreenU Marijuana and ScreenU RX. So again, just go to that link and we can set up a one-on-one and go through all 3 programs with you. And then lastly, there was a quick question about the graph that EverFi provided. There was different sizes of the circles when looking at impact versus cost. The bigger size meant they're more commonly used on the campuses that they surveyed in that research study. One other question from Doug. Can you talk about the differences between this and K6, which is similar to basics for cannabis?
Great question, Doug. So that's a great question, Doug. So with K6, again, it's a one-on-one, typically done program program
focusing on motivational
interviewing.
And at least on our campus, it's done in two 1-hour sessions. And I know campuses implement it in different ways, but one of the big differences, of course, is the brevity of ScreenU, and that it doesn't require a person to deliver it in person. And so that really helps out with campuses. In fact, we've had a number of campuses who have implemented ScreenU as kind of a first step with their basics program, of course, because we haven't had ScreenU marijuana available a lot. So in talking about that, I'm thinking more about basics, and they've used it as kind of the first point of contact with their students, and they complete ScreenU, and then they have their audit information and score, and they can share their risk level with the provider who is working with them on K6 or basics. So I think there's a lot of opportunity for it to be done in tandem and complement each other. And it really just depends on how you're utilizing it. But I think the biggest difference between the two is, one, the brevity, and that it doesn't require a staff member to be able to implement it.
We had one more question come in, Cindy. Somebody asked, how often do you suggest we screen our students?
That's another great question. And of course, I think our ideal vision with ScreenU is, well, SBIRT was developed to be a universal intervention. And the idea was to screen everyone who walked in the door. And so I think if universities can look at that as the ultimate goal, is every year we screen everyone that walks in our door on campus, and then we can continue to do that annually. Perhaps we look at doing it every semester as a way to boost. And then if we have other groups that may be at a higher risk, or it's a high risk time on your campus, that might be another opportunity to implement ScreenU. I think because it's so short, students don't mind taking it more than once. The way they might mind taking other web-based prevention efforts multiple times. You know, if it only takes me 5 minutes, then I'm not going to think much about having to do it multiple times. And so I think the gold standard that we would like campuses to strive for is to screen all of their students on campus every year, at least once a year, if not twice.
Thank you. I don't have any other questions coming in, so please take a moment, poke around ScreenU.org, set up a demo for you or your campus. We're looking forward to engaging in conversation with you about ScreenU and the best ways to use it. We've had a tremendous amount of feedback from the 28 schools and the really creative ways they've learned to implement ScreenU Alcohol and ScreenU RX with their students. So many different creative ways and so much positive feedback. So we're excited about where this is going. We appreciate your time. And we hope to stay in touch. You all have a great afternoon.
Thank you.
Thank you.